Rebecca Jacob. I'm a public health nurse with the School-Based Health Center program, and I am going to be presenting this webinar with Kate. Kate, do you want to introduce yourself?
Hi, everybody. I'm Kate O'Donnell. I use she, her pronouns. I'm the School-Based Health Center Program Coordinator with the Sbhc State Program Office. I'm stepping in this morning for Karen Bayan, who's Rebecca's counterpart, another public health nurse who's not feeling well today. So glad to be here.
All right, so just a couple of things. This is being recorded, but there isn't any, you're not going to be on video during the recording. We would love to see who all is here, and I'm sure that others would like to hear from you. So if you could put your name, your Sbhc, and maybe role, because I think most of you are coordinators, but there might be some others on the call, that would be great. And if you want to share anything else like contact information or, you know, wanting to connect with others, that's a great place to do it. So you all can have some conversations. What else? I think that's it before we can just go ahead and get started. So, so this is the School-Based Health Center orientation webinar. So we have most likely quite a few new coordinators on the call, but we also have people who enjoy coming every year to just get a refresher about, you know, what all we're doing. If you have any questions, please put them in the chat. And then we also have question periods at the end of each sort of section if you want to ask us questions. So, and then Kwong's going to be helping out with the slides. So you're going to hear a lot of next. So Kwong, next, please. Okay. So these are the topics we're going to cover today. Our unit, school-based health centers, funding, standards, data. We're going to show some youth-centered Svhc photos and talk about youth involvement and resources. Next slide, please. And then first we want to orient you to our office. Next, perfect. So the Sbhc State Program Office sits in the Adolescent and School Health Unit, which is part of the Oregon Health Authority's Public Health Division. Other programs in the Adolescent and School Health Unit include the School Nurse Consultant, a School Nursing Pilot Program, Youth Sexual Health Program, Policy and Assessment, House Bill 2591, which is the School Health Service Planning Grants, and then Mobile School Linked Health Center Program and School Linked Telehealth Pilot Program, and then also COVID-19 School-Based Recovery Program. Next slide. So in total, the Adolescent and School Health Unit is a group of about 16 individuals that work to support all youth and adolescents in Oregon. And our vision is that Oregon is the very best place for youth to learn, grow, and thrive. And our mission is to support the health of all youth in Oregon through evidence-based and data-driven policies, practices, and programs. Next slide. So we refer to ourselves as SPO, State Program Office. You'll see it written and we'll say it a lot. And we are a total of 9 employees. And our main functions include certification. So we work to ensure and monitor compliance of the state standards of certification and provide technical assistance to sites, policy and program development, data collection and analysis, and funding. Next slide. And this is who we are. So we have Rosalind Kwong, who's helping us out today. Micah is on the call somewhere. Kate and Melanie. And next slide. And Sarah, Loretta, Kavita, Karen, and myself. So let's move on to talk about Oregon school-based health centers. Next slide. So here are some photos of the SBHCs around Oregon. And as you can see, they look very different depending on the community capacity. I think, as you all know, some are in schools, some are modulars outside of schools, some see the community. And SBHCs are a unique healthcare model for comprehensive physical, behavioral, and oral health services provided to youth on school grounds. And the idea being that students will miss less school and be ready to learn in the classroom. They also are unique in that they provide population-based youth-centered care that follows best practice, comprehensive best practice guidelines. Next slide. And some of the unique characteristics of SBHCs are that they're integrated into schools, built on partnerships, youth-centered and convenient for students and parents, accessible and effective. Next slide. So SBHCs are built on what the National School-Based Health Alliance recognizes as core competencies. And these are the 7 core competencies that represent the knowledge, expertise, policies, practices, and attributes of every SBHC. And they are access, student-focused school integration, accountability, school wellness, systems coordination, and sustainability. And it's a great resource. There's a link down below. And I believe, Kate, right, we're sending out this PowerPoint. So any of the resources that you see listed here will be available for you on the PowerPoint. Next slide. So in numerous nationwide studies, SBHCs have been shown to improve health-related outcomes, and use of SBHCs is associated with increased use of vaccination and preventative services, reduced asthma morbidity, fewer emergency department visits and hospital admissions, higher contraceptive use among females, improved prenatal care and higher birth weights, lower illegal substance use and alcohol consumption, and reduced violence. It's pretty big. Next slide. And SBHCs have also been proven to improve educational outcomes, reduction in rates of school suspension, higher high school completion, increases in grade point averages, and increases in grade promotion. Next slide. So as of July 1st, 2022, we have 81 certified school-based health centers in 26 counties. 52 are in high schools, 6 are in middle schools, 10 elementary schools, and then 13 combined grade campuses. Next slide. And here is a map of the counties that have the school-based health centers, along with what they are, who they are. Next slide. So as of July 1st, 2022, of the 81 certified school-based health centers, 73 are sponsored by FQHCs, 46 are state recognized as patient-centered primary care homes, 46%, and 64% are in primary care health professional shortage areas. Next slide. 9 SBHCs have a dental provider on site, and 95% of SBHCs have a mental health provider on site. So reasons for SBHC visits in 2020-2021 school year. So we're talking about ages 5 through 21. We do get the data on all the age groups, but we focus on the 5 through 21. So 48% were primary care visits, and the breakdown is 22% for preventative care and 26% for acute care, and 51, over half, % of the visits were with the behavioral health, and then 1% with dental. Next slide. So although our current certification standards do not require mental health therapy or behavioral health on site, 95% of SBHCs do have either behavioral health services on site. The structure varies across sites, some using behavioral health consultants that are embedded in the primary care team, while others operate a more traditional mental health outpatient model. Behavioral health folks in the SBHCs play a super important role in the school community, many working closely with school counselors and promoting school integration and SBHC referrals. Okay. I'm turning this over to you, right, Kate? Okay.
That's right. Thanks, Rebecca. So I am going to talk a little bit about everyone's favorite topic, the money, and what Sbhc funding looks like. Next slide, please. So when we talk about funding for state certified school-based health centers, there's really 3 buckets. So it's our base operating funds, our mental health expansion grants, and then additional funding opportunities that we sometimes have available from our office. Next slide. So when we talk about base funds, really they are the base operational grants of $60,000 a year that our program provides to certified school-based health centers. And base funding is really pretty flexible funding. It can be used to support anything that helps with the SBHC operation. So there's some examples on the website or on the slides right here. So it could be anything from staffing, service delivery, supplies. We understand that $60,000 is not going to single-handedly operate a school-based health center during a given year, but it usually does help to support some level of operations. I think under service delivery, we often will name 2 like non-billable services. So a lot of times people will use that base funding to support services that they cannot bill for various reasons. Next slide. The next area of funding is the mental health expansion grant, which I think folks may have seen in the chat. Micah Rotman is here, who is our coordinator for these grants. But these are grants that were initially given to our program back in 2013 from the state legislature to help address the unmet mental health needs of young people across the state. So we currently fund 69 SBHCs with capacity grant funds and 25 folks to do youth-led project grants. Similarly, with base funding, the mental health expansion grants often don't fully fund a staff position for behavioral health services, but they really kind of help folks, for those non-billable services or to leverage partnerships to provide behavioral health supports in the centers. We currently did not receive additional funding for the mental health expansion grants during this biennium. If people can hear, I live very close to the airport and there's a very loud plane landing right near my house right now. So we didn't receive any additional funding for the mental health expansion grants in this biennium, but so we don't have any funding available to bring additional sites in, but we are currently looking at the way that we distribute this funding to see if we can spread it more evenly across all the sites across the state. And as I said, Micah Rotman is here, also hearing an airplane at their house if folks have questions about the mental health expansion grants. Next slide. So the final bucket is really those additional funding opportunities, and these really depend on what funding we have available every biennium. In the past, we've had one-time grants that we've offered for things like, buying supplies like iPads, exam tables, vaccine fridges, and then some targeted grants around like outreach and engagement and youth-centered clinical environments. Next slide. In 2022, we also had a good number of funds become available through federal and state grants. And so these are listed on the slide. Rebecca named some of these in the intro about the work that our unit does. But the first one is federal funding that came through related to COVID-19 response and recovery. And then the last three were ones that were actually passed through the Oregon legislature to help with some, to plan for new school-based health centers, and then do some pilots of some additional models for school health service delivery. Next slide. So some important logistics about how our funding works. So all state funding, with the exception of these like one-time federal grants that we had available, comes from the state legislature, and it's state general fund dollars. And so every year you will hear us say, this funding is contingent upon state legislative approval. And so we depend on the legislature to really set our budget. The good news is we've had a lot of really strong support from the state legislature for our funding, and have not really sustained any cuts to our funding in recent memory. Usually the legislature is like, how do we give the school-based health centers more funding? And so we really try and get that out the door to support service delivery for all of you, and to expand the model to new communities. So logistically, there are a couple of different ways that the funding can actually flow from our office. So traditionally, the one on the left, this red graph, or this red visual that says State Program Office to LPHA. LPHA stands for Local Public Health Authority. We used to exclusively just send money through local public health authorities. However, in 2017, we made some changes to the way that our funding can be distributed. So another way that it could work is this blue visual in the center. So the State Program Office gives the money to a local public health authority, and the local public health authority could say, actually, we're going to subcontract this to a medical sponsor, like a federally qualified health center or hospital system, to operate the school-based health center. And then that local public health authority can also decide to subcontract to a mental health agency to deliver the mental health services in the school-based health center. The third way that funding could work is if the local public health authority says, actually, I don't want to have involvement in the school-based health center program for whatever reason. We call that the local public health authority first right of refusal. So they really get to determine whether or not they want to have involvement in the school-based health centers. And so if they do determine that they don't want to have any involvement, we're able now to directly contract with the medical sponsor agency. So I think at this point, about half of our centers operate in this way, where we contract directly with the medical sponsor agency. And then if the medical sponsor agency determines that they are not able to or don't want to deliver mental health services directly, they can subcontract with a separate agency to deliver the mental health services. So very complicated. Hopefully in practice, many of you don't see this happening. It happens in the background. But I think we can go to the next slide, and we can pause for questions, anything about funding, or some of the general information that Rebecca shared about the model. You can feel free to unmute or enter in the chat if you have questions.
Hey, this is Kristen. I was just curious if you have statistics on the percentage of SBHCs who are receiving funds from their school districts, or if that's not something you guys keep.
That's an excellent question. I think we could get that. We do collect some financial information in our operational profile. I don't have that off the top of my head right now, but I think it's something we could look into and get back to you about. It's a great question. Do you happen to know, Rebecca, anecdotally from when you do your site visits?
No, I mean, I would say that certainly not all SBHCs receive funds from their school district, but some do. That's all. That's, you know, all the information I have. But it's a good question. It would be interesting information. Any other questions before we start in on certification? I know everybody's waiting for that section. Okay. All right. So standards of certification. So these standards apply to all agencies providing services within the Sbhcs. So that includes primary care, behavioral health, and dental providers. And as we move into this school year, we're expecting that Sbhcs are meeting the standards of certification. I think, as you all know, during at least the first year of COVID, we did not require Sbhcs to be meeting our standards. So what is certification? The Sbhc model in Oregon is outlined in what we call these standards of certification, which are written into Oregon administrative rules. So these rules establish the criteria our office uses to certify, suspend, and decertify Sbhcs. And certification is a voluntary process, so only the sites that meet this model are eligible to become state certified and receive funds from our office. Next slide. So the standards of certification are informed by these three areas: comprehensive best practice, youth-friendly services, and population-based patient-centered care. And the concepts are defined by the agencies in the blue boxes. I'll just give you a second to look at that one. All right, next slide. So we'll go over some of the major points of certification to better help understand the model. We don't have time to go over all the requirements, but we do have a copy of the standards online for reference on our website. And so certification process: sponsoring agency, facility, operations and staffing, comprehensive pediatric healthcare, data collection and reporting, billing, and terminology. So the standards are broken down into those sections. Next slide. Oh, perfect. So a sponsoring agency is someone that provides the Sbhc with or contracts with someone to provide one or more of the following: funding, staffing, medical oversight, liability insurance, billing support, and space. So for example, a school is a sponsoring agency because it provides the space. Medical sponsorship requirements include medical liability coverage, ownership of medical records, and medical oversight. And for example, like a medical sponsor would be the health department or the FQHC, like we talked about in funding. So it's the entity that provides those requirements. Next slide. So a site coordinator, of which many of you are, they're so important to our program. And our office requires that each site designate a site coordinator employed by the sponsoring agency, so the medical sponsor. And the responsibilities are vast, as you all know, but they include serving as the primary contact between the Sbhc and ourselves, and helping to keep the Sbhc in compliance, and then notifying us when they're out of compliance, preparing for and attending certification site visits, and submitting required information, data, satisfaction surveys, etc. Keeping the operational profile up to date, attending meetings, so coordinators meetings, of which we have, is it three? Three, okay, a year. And forwarding to communications to others within the Sbhc. And this is particularly important because we do share a lot of information, and some of it could be very useful to others that work in the Sbhc. Next slide. So operations and staffing. The standards say that Sbhcs must be open and offering clinical services a minimum of 3 days a week when school is in session. So like summer breaks, things like that, we're not requiring that you're open. Clinics must be open for services at least 15 hours a week with availability for same day and scheduled appointments. And at least one licensed medical professional must be available on site each day the Sbhc is open. And there's examples there of what a licensed medical professional would be for the SBHC. These next two areas are ones that we often get a lot of questions about and ones that we often get a lot of waivers on, right? Next slide. Okay. So this chart is in the standards, if you need to reference it. Minimum staffing for SVHCs are office health medical assistant working 15 hours a week, primary care provider working 10 hours a week, splitting those hours to be available 2 days. And then also an additional healthcare professional working a minimum of 10 hours a week. So that can be behavioral health, oral health, the medical provider could be working all week. It could be an RN. Okay, next slide. So eligibility for services. The standards are very clear that all students in the school are eligible for SBHC services. Some SBHCs serve school staff, other districts, and even the community. It also states that students shall not be denied access to services based on insurance status or ability to pay. So no students are turned away from SBHC services. Many SBHCs do not collect any fees for their services. So for example, co-pays that might be required. And if fees are collected, clear communication and knowledge of cost is super important to reduce barriers and access to the services for the youth. Okay. Next slide. So what services are required to be in the SBHC? The goal of the SBHC is to provide pediatric health care in line with nationally recognized standards of care. So the certifications are based on the American Academy of Pediatrics Bright Futures. And Bright Futures uses a strengths-based approach and sets sort of a gold standard for screenings and what's recommended at each age group. Next slide. So not that you can see it, but I think at this point, many of you are familiar with this table and what we require to be on site or by referral.
Hey, Rebecca.
Yeah.
Hi, good to see you guys.
Hi.
Quick question going back to the
Yes.
previous slides, because
Yes.
that's one of the main reason I'm here today.
Okay.
It's in regards to this Bright Futures. Is there any, in the past, we were able to access those, you know, the forms and the handouts free?
Yeah.
Has that changed?
So you can't access it, correct?
Well, you know, the anticipatory guidance is what I'm looking for the wild child checks and stuff like that. And they had such a well laid out thing, and I just would use it. But I don't seem to be able to access those any longer unless I pay for the.
Yes, I think that's correct. And
Okay.
we had a conversation a couple of years ago. I'd say everything's pre-COVID, but you know, about using something and requiring something that causes people to have to pay for it. So
yeah, and they're quite expensive actually.
Yeah, they did move to a membership situation, and we were talking about it, you know, and I think it's something that we will take back again. I don't know, Kate, if you have any other comment, but on that. Yeah.
Okay.
Yeah, it's come up, and I thanks for bringing it up, and we will take it back and talk about it.
Thanks, Rebecca.
Yeah. Okay, so yeah, these are our minimum requirements, right? So a lot of SBHCs do more than what's on this. This is what we minimally are looking for an SBHC to provide. Okay, next slide. So billing. The standards say that all providers eligible shall bill OHP And also that all providers should be billing private insurance whenever possible. In addition, SBHCs must determine whether their coordinated care organization has the ability to maintain confidentiality when billing for services that are confidential, right? So suppression of EOBs. And if this procedure doesn't exist, then SBHC needs to work with CCO to determine how to do that, because I think we all know that confidentiality is super important, and one breach can cause a lot of issues in your school. So next slide.
Rebecca, do you mind if I make a comment on that? Just since
Yes.
we're there and we have new people.
Yes.
That's the question of EOBs.
Mm-hmm.
I was just going to say, don't forget your labs or your third. Oh, I'm just realizing my microphone is up on my head. That they, when you're figuring this out, that part out, don't forget your whoever you're using for labs, because we have run into this ourselves where we suppress our EOBs for ourselves, but we forget we haven't suppressed the or told the lab to suppress the EOB, and so we've run into that situation. So it's just something to watch out for.
Thank you. So important. And we do hear about that difficulty for sure. Thank you for bringing it up. Okay, waivers. So when an SBHC becomes out of compliance with our standards, a waiver is submitted by the coordinator into the operational profile. And that's the database that we use to collect, a lot of information about the SBHC. So the SBHC must notify the program within 20 calendar days of any change that brings the SBHC out of compliance. An example of a waiver could be, if primary care provider retires November 1st, then by November 20th, we would want to see a waiver in the operational profile. And then we have 2 weeks to approve or deny that waiver. So the waiver should include an explanation of non-compliance, plan for corrective action, and a date for meeting compliance. And then we'll work closely with you throughout that time to sort of get updates. And this, we definitely can extend waivers on certain things, and we'll work with you on those. So next slide. So this represents a few years of operations and staffing waivers. And in 2021, we did not require waivers for that first year during the pandemic. And then the majority of the waivers in the 21-22 time were for operations and staffing. And I think, like I've already said, as we move forward into this year, we're coming back to the standards and requiring that that y'all meet certification standards. Next slide. All right, site visit. So this picture, we do not have a picture of Karen or myself. This is Lisa. I don't know if any of you know her. Ceci, you know her, but she was in my role before I was in my role, and that was like 4 years ago. We don't have a picture, maybe 5 years ago. Anyway, there it is. When a new SBHC applies for certification, and then every year when the site completes the operational profile database, that site is attesting that they are meeting our standards of certification. So the site visit is one method for us to ensure that those standards are being met. And the site visit in general occurs within 1 year of the site opening. I think it's more like 4 months, but and then every 2 years for a representative sample of SBHCs in the system. So for example, if a sponsor has 8 SBHCs, we might go to 4, like in the 2020, the 21-23 biennium, and 4 in the 23-25 biennium. We might also do less, or we might also do more. So it's sort of a representative sample for that sponsor. And then our goal on the site visit is to support the SBHC in compliance and provide any assistance. Next slide. So if you're not familiar with this tool, it is posted online. It's what we use during the site visit, and also what we encourage the site coordinator to also fill out prior to the site visit. And that way, you know, we both sort of know what's happening, and if there's any action items that might come from the site visit, you'll know by filling out that tool.
And Rebecca, is this the most updated one as of August 2022?
Yes, we have one updated for this year. Mhm.
Perfect.
Yeah.
Thank you.
Yeah. We're usually there for the majority of the day and hold a debrief after it's over, so we can all talk about what's happening in your Sbhc, and you can tell us all the great things that you've been doing, and you can invite partners, like, you know, school principal, whoever you all partner with and want to hear. We will at that time be sure to let you know what action items. There shouldn't be any surprises. Next slide. So any surprises when you get your site visit report, right? We would have already talked about the things. So site visit report is basically all the things you see right there that we write up for you. And next slide. And then the action items. So if we find any action items, it's not a big deal. It's just something that needs to be corrected. And it's written up like this, and then we have a plan. So oftentimes the plan is to like send us a photo. So if it's a lab QC situation, we'll want to see 3 months of like correct QC. And so you'll just send us a photo of that log, and then we'll resolve the action item. And usually the deadlines are 30 to 90 days. Some action items, I think some of you already know, are things like, I lost my train of thought there, but policies. So oftentimes policies take they have to be reviewed by your board, or there's all kinds of things that happen with policies, right? So sometimes if the policies aren't reviewed and signed every 2 years, then that's sort of an action item that I see often getting extended. Next slide. So once you're certified, you get this plaque to put on your wall, and then we send you a new sticker every biennium that shows that you are a state certified school-based health center.
Rebecca, one more question on this. Sorry, I'm interrupting here and there. The pieces that wanting some answers. We have 2 of our sites, they're completely filled this up. We have no room for any more stickers.
We get you a new plaque.
Okay, so
yeah, just email me
or
get you a new plaque. Yeah.
Do we request, or when you send the stickers, you're going to send it with it?
No, yeah, request it. Just email your nurse, which is me. I'm your nurse. And then
Rebecca?
Yeah, can you hear me? Yes. And then we'll get you a new plaque, and so then you can just have the multiple plaques.
Okay.
Yeah.
Thank you.
Yeah. Okay, are there any other questions about certification before we move on to data and reporting, which Kate is so graciously going to cover?
I think there's one more slide.
Is there one more slide?
Here, yeah.
Oh, so sorry. There's one more slide. So, that's backwards. The plaque should have been after this, but whatever. Okay, so things to notify our office about if these things happen, right? So new coordinators, because your role is so important, it's great for if you can let us know when there's a new coordinator coming on. And sometimes this isn't your role because maybe you're no longer the coordinator, but if your medical sponsor, administrator, whoever can let us know, so that we make sure that we're not missing the connections. medical sponsor change. So we have a process for that. Sometimes the medical sponsor changes for the SBHC, and we have a process for that we go through. Transfer of location on or off school grounds. Those things also happen. If your school is under construction, which happens a lot, and your SBHC moves out to a modular, we'll want to do a site visit to ensure that you're still meeting our standards. Closure, opening, and then we'll work with you. So, okay, now I think it's data and reporting. Does anyone have any other questions about certification? I know that that was a very brief overview. Okay, I'm gonna let Kate go.
Thanks, Rebecca. So I get to do the driest of the driest part of this fairly dry presentation, but I promise try and keep it exciting. And then after data, we're going to get to do some more pictures of the centers and talk about youth friendliness. So hang in there. We'll get through this last part. Next slide. So when we talk about data requirements, these are the pieces that are listed on the slide. They're all in our standards for certification. They're also on our website. We have a data and reporting section of our website that really gets into some details around these different areas. But just for you all to know, all of these pieces are really ultimately sit with the coordinator, and we really look to you all to help make sure all of these pieces are complete. I think Rebecca and I have referenced different things about the services that centers provide, the things that they do. We're only able to share this information because of the data that you all submit to us. And so it's really super helpful for us as a program to talk about the great work that you all are doing, but then also to give it back to you all to share information that could be helpful for your operations. So next slide. So the first thing I'm going to talk about is the operational profile. And Loretta Gallant, who many of you know, who is unfortunately on vacation this week. Well, fortunately for Loretta, is on vacation, but was really the person who knows all the things about all the data pieces, and did a really great overview presentation about the operational profile a couple weeks ago. That's available on our website. So I'm going to keep this presentation really high level, but if you want to know more about the operational profile, definitely check out that webinar. It really will walk you through how to use this database. But from our end, this is really what we use to make sure that all the centers are meeting the standards of certification. It's an online database that each system can access by using a unique login and password. If you are having trouble accessing it, like your password doesn't work or you need a new one, if you're a new coordinator, just email our office and we can get you set up. So you can see across the top in the red box, these are all different tabs that ask questions about your SBHC operations. So, you know, the hours of operation that you're open, the staff, the shift hours, the services that you provide. The waivers tab is where you go in and submit waivers if your center is out of compliance. There's the KPM one for key performance measures. And then the last two are revenue reporting slides for public health revenue or primary care revenue and mental health revenue. And Kristen, to your question, I think that you had asked before about school contributing money. This is like a great example of like, we can go into that revenue tab and look, there's a line item that says the amount that schools have contributed towards just SBHC operations. And if Loretta were here or if I were smarter at the operational profile, I would have been able to run a report while we were talking to get the answer to that question. I tried and I was not able to. So, but that's an example of like, if you have a question about what other sites are doing, we can use the information that you submit in the operational profile to run a report and share that back with you. So that is to say, I will hopefully be able to follow up when Loretta comes back around the school question. Next slide. So when does the operational profile need to be updated or submitted? So really important for you all to know at the initial site certification. So when you are a new site coming in, by October 1st of each year. So we are coming up really close to that deadline. Every year we want folks to go back into the operational profile and make sure that the information is correct and updated. That's also when you submit your KPMs and the financial revenue information. We also want it to be updated, just check it prior to your certification site visit. And then at any point when staffing changes occur during the year. So if you have a staff turnover changes that you need to update, you can put it in your operational profile when that happens. And then there's a link to at the bottom, our email address. Again, if you have questions about the operational profile or have trouble, feel free to email us. Next slide. So as I said, there was a really great webinar that Loretta did a couple of weeks ago on how to use the operational profile. There's also an operational profile user's guide that's available on our website. If you want to check it out, it has great screenshots and information about how to use the operational profile. I have a note here that's especially important to follow the instructions on how to properly delete staff from the Sbhc, because I think there's a way that you have to connect with us to get a staff person removed if they leave, so they don't continue to show up as working in your school-based health center. So that's in the user's guide for you to check out. Next slide. As I mentioned, there's the tab for operating revenue information. This is also due October 1st of every year. It's in the operational profile in those tabs. It's looking back. So a lot of the information that you enter into the operational profile each year is about your current Sbhc operational information. The revenue is a little bit different because it's talking about the last service year. So July 1st through June 30th of the previous year of what was your operational revenue during that previous school year time period. And so as I've mentioned, there's the two revenue entries, the physical and dental health services, and then a separate one for mental health services as well. Next slide. Another important piece is the key performance measures. So we have these in place to help support clinical quality improvement and clinical best practice in all of the school-based health centers. Centers are required to do 2 key performance measures. So all the centers are required to do these. One is well visit and the other is a comprehensive health assessment. Karen has a link to a resource to do like some starter guides for doing some work around those quality measures. All Sbhc staff work together to raise these measures. So for example, a mental health provider would ask clients if a student has received their annual well visit, and if not, ideally would coordinate for the student to get that well visit. And so it's really kind of across the clinic trying to make sure that young people are getting access to these services. Next slide. There also is a requirement for the centers, for each center to select one optional measure in addition to the 2 required key performance measures. So here is a list on the slide of all of the optional measures that we have for this current biennium. So you could take a look at those. Similar to the well visit and the health assessment, really we are looking for the whole center, so behavioral health and primary care and oral health, kind of everyone working together to make sure that these measures are being met. And then Karen has a link to a great starter guide from the Adolescent Health Initiative to help think through what this might look like for your clinics. Next slide. And so we are again doing this presentation close to the deadline for submitting your key performance measure information for the previous school year. So to report out on your progress on the key performance measures, Sbhcs are required annually to perform a random chart audit. So really any physical, mental, or oral health visit for clients between the ages of 5 to 21 are eligible to be included in that chart audit. We have guidance documents on our website. Again, would reference our data and reporting tab on our website that really outline the definition of these measures, who can be included, who would be excluded in these chart audits. There is also a webinar that Loretta did back in the spring, I think, maybe in May, that really kind of digs into the key performance measures. So would definitely encourage y'all to check that out too if you want more information about key performance measures, both the reporting, the auditing, and then just the implementation of those. Next slide. So visit and encounter data, another very important piece of our data requirements. So our standards require that all certified school-based health centers report to our office every visit that occurs at the school-based health center. So these are for all services, including physical health, behavioral health, oral health, whatever is provided at within the school-based health center, regardless of the client's age. This is, again, so important for us to both report back to you all about what centers are doing, but then we also, every legislative session, get asked by the legislature, what are the centers doing? And we really use this information to share back all of the great work that you're doing. We also use this to we do an annual status update to talk about what centers are doing, and all of this information goes right into that report. So, and you can use it to, there's other things on here. If you're applying for grants, if you're presenting to your local school board, all that information can really be helpful to talk about the great work that you all are doing. Next slide. We have two different deadlines for visit and encounter data submission. So they have to be, there's a mid-year reporting deadline, January 15th of each year. And that's for visits from July 1 through the end of the calendar year. And then there's a year-end reporting. July 15th is that deadline, and it includes all visits from the previous service year. This information has to be submitted in a secure format. Usually that can be Loretta initiating a secure email to you all to submit the data. For folks who use OCHA and Epic for their encounter, for their EHR, you don't usually have to worry about these deadlines because we have a direct feed through OCHA, and we get your data actually monthly from them. So this really only applies if you use a different EHR system for your visit and encounter data. Next slide. Another data requirement we have is around student satisfaction surveys. And so all certified school-based health centers are required to administer a satisfaction survey that our office develops. And really the purpose is to get feedback from young people about the services that they're receiving at the school-based health center. At this point, we historically have done these on paper, but at this point, pretty much everyone administers them on an iPad. We send out the survey in early October to get the new survey for your use on the iPad. And we ask that you administer it to a random sample of clients ages 12 to 19 years old. So really try and not send it to parents or guardians, but have young people themselves fill it out. We also ask that you not administer the survey to the same client multiple times, but really have people fill it out just one time during the school year. We calculate a minimum number of surveys to complete based on the number of clients that you served last school year. And so the idea is to get kind of a representative sample of the clients that you serve. And so again, stay tuned for more information about that. Will be coming out in October. Next slide. So similarly, we have deadlines that mirror the encounter data submission deadlines for the satisfaction survey. So January 15th is a mid-year reporting deadline, and then June 30th is the year-end reporting deadline. Basically, you are able to just upload these surveys by syncing your iPad, and we get those surveys uploaded to us. And so similarly, at the end of the school year, would do the same thing to transmit that information to us. Next slide. We also added a requirement to notify parents and guardians in some manner about the satisfaction survey, just so that they're aware that their child would be asked questions about their experience at the school-based health center. So we have this language that you can post online. You can put it in up on a wall in the center. You could put it on like an intake form just to notify that this survey could be administered to them. And you can find it, we have the language in English and Spanish on our website. And that's also maybe something that I didn't say. So the survey is available in English and Spanish on the iPad. Next slide. The last kind of data-ish requirement is our mental health expansion grant reports. And so these are due similarly around the same times as the data submissions. So there's a mid-year capacity report due in January, and then one in July. And then if your SBHC receives youth-led project grants, it's July 15th. Typically, these are narrative reports. Some of them have like multiple choice questions, but really to just get a sense of how things are going with mental health, behavioral health at your school-based health center, ask about areas where you might need support. And then we often ask for folks to share stories about the work that they're doing with the funding. And this information sometimes makes it into publications that we put out, like our annual status update, or we often will share them with the legislature when they ask about what folks are doing with our funding. Next slide. We made it. That's a lot of information. We tried to keep it fairly high level. It's pretty complex. So if you have questions about any of the data requirements, Rebecca and I can do our best to answer. But again, Loretta from our office is really the person who knows all of the things. But we'll pause right now for questions.
So I have two questions, and I can certainly ask Loretta if she is the better, if you want to defer. One of the things is for the KPMs. I thought that I had read, or when watching the training for that you had to, that the well child check, for the well child check KPM, that it was that we had to like see if they had a well child check anywhere. It didn't have to be just within the Sbhc, that's kind of what we're like looking for, pursuing. And I'm wondering, like, at what, I don't know how to put this, but like at what extent you need to do that, and then what would you mark if you don't know history for a patient with that kind of situation? So that's my first question. And then my other question is that someone was asking about the data requirements, and a lot of it's aggregate data, but then there is a spot where it says that it wants like an MRN for every patient. So I'm wondering if it needs to be like line by line data for like each patient, like, or if it could, we can more, and this is because we're talking to different people about mental health, and they are uncomfortable with the idea of giving like MRNs for every single patient. So I'm just wondering, like, do you have to do that, or can you just give the aggregate data for everything? So that's it.
I can do my best to answer the question. So please jump in, Rebecca, too. And we can also pull in Loretta when she's back. But so for the first one, so you had asked about the well visit documentation. And so, yes, there is a requirement. So it's not just the well visit in the center. I think the idea was really we're just wanting to make sure that young people are getting well visits, and the center, the school-based health center, doesn't necessarily have to be the venue for getting those. It's just like making sure that they've been provided. And so there's some information in our guidance document on our website, but essentially the idea is you would potentially ask the young person if they had gotten a well visit. Again, it's like could be hit or miss if that you're able to get that information. If it doesn't seem like they have gotten it or they have a assigned primary care provider elsewhere, the expectation is that we have one documented attempt to attain that information from the primary care provider. So that could be like, we called them and they said that they had provided the well visit, or we tried to contact them and we couldn't get any information. And so like just documenting that attempt was made would kind of count towards, the numerator. And so I think there's also information about, there's a couple of different scenarios in here. So that's one, that there's another situation where maybe the client or the parent claims that the well visit was provided elsewhere and you made an attempt to try and get that information. And then there's also, if a client doesn't show up for their visit, where you had tried to make the well visit happen, you can also kind of count that as a visit if they don't show up twice. There's also an exemption for, if they want a confidential visit, and if it seems like trying to get that information is going to violate confidentiality in some way. So there's some things that's in the guidance document, if that's helpful. I think Loretta probably could also talk you through maybe some situations or how it would look like for your clinic. Does that answer your question?
No, that's super helpful. When I did the audit, and there were a couple of times where I was like questioning like whether or not I should be saying non-compliance or what the response should be. And since it wasn't a year where we had to like absolutely get hit the benchmarks, it was a little bit easier to say something was non-compliance. But I know for I'm already thinking about next year and like trying to think about, okay, well, how do we want to do that? And we use OCH and Epic. So if they're in care everywhere, it's easy. But when we have a patient who presents who doesn't have a PCP, we don't know whether or not they have a well child check, and they have no idea who their PCP is, like in Epic, then it becomes really challenging. Like, how do we know who to call? How do we know who to reach out to? Like, so, and then you end up, I was marking something like that non-compliance, which it technically is, but then it's like, well, but then it's like, we don't really have any recourse. Like there's nowhere for us to, there's nothing really, there's nothing more I feel like we can do as an SBHC to try to get that child in for a well child check. Like we've done our due diligence. It's just that, so it'll be good to talk to Loretta a little bit more about it, I think.
Yeah, I think Loretta is a great resource. And I mean, I will say like just big picture thinking about the goal of these is really like what you're already doing is to like think about how to make sure that that young person is getting those services, which it sounds like you are doing. And it's more of just like, how are you documenting and getting credit for the work that you're doing? And I don't know, Rebecca, if you have any other thoughts on like the clinical piece of that, but.
No, I think, yeah, you've summed it up. And also I would say, Loretta has, this was very brief as far as what the data and the KPMs are. And she does have a webinar for both of those things that, and they're posted on the website.
I think it's always good to be very, very clear on what is non-compliant or excluded and out of population. Those definitions needs to be very clearly defined, because you can put one on the other category if you're not very clear in your mind what that yeah.
And I will say like it is helpful to hear from you all about like what situations are coming up. I think when we initially drafted these guidance documents, there was one exemption, and it was like you made 2 attempts and then that's it. But I'm looking at it now and there's 6 exemptions now that I think these are situations that have come up for folks. And so it's helpful to hear what those situations are. Again, like we want to give you credit for the good work that you're doing, and you're being thoughtful about like these different situations. And so I think if you want to reach out to Loretta or email the program in general to talk more, we're happy to do that. I know you had asked another question about,
Sorry, yeah, I know I asked two big ones in a row. The other one was about aggregate data and whether or not we had to do have to supply individual line items for like patient identification numbers and that kind of thing, whether or not that app is absolutely necessary or we can just supply aggregate data.
So we do require the individual patient information, including the medical record number, and that's really for us so we can report out. I mean, even though we are reporting out aggregate, they are Loretta and Sarah and Kavita are running many smart people reports in like data analysis software to really kind of cut the data in lots of different ways. And it's not possible to do that if it's just an aggregate. They need it on the individual level. Yeah. And so all those requirements in the certification standards are for individual level data. So these are great questions.
Okay. Shall we move on? All right, let's go. All right, so this is not the dry part of the of the presentation, hopefully for you all. So youth-centered SBHCs, right? Super important, and we just want to share some photos of school-based health centers across the state that sort of show and represent this. So next slide. Okay. So what are youth-centered services? So the Adolescent Health Initiative, which we've referenced a couple times throughout this presentation, is a great resource for creating youth-centered SBHCs. So they provide some recommendations with guidelines when thinking about creating spaces in clinics. And we have many great photos of Oregon SBHCs. I would say not many from the past couple of years. So if you all have been to this webinar a few times, you might see some similar photos. But since we didn't get to go out and do site visits very much. And so, these depict how SBHCs are aligning with these principles. So the first recommendation is to make your services accessible to youth. And then and then next slide. Oh, that's easy. Provide extended hours and same-day appointments. So here's clearly posted appointments available throughout the day, including lunch and after school, and making sure that walk-in times are available for students. Next slide. Establish policies that ensure youth can access services for free or at low cost. So here's a good example of posting that on the website and making sure that folks see it. Next slide. Ensure the SBHC location is easily accessed. So by being on school grounds, SBHCs are easily accessed, but it's important for students to know, students and families as well, to know where they are. Next slide. Another example of that. And then provide services and materials in languages most spoken in the community. And next slide. So the next recommendation is to create an environment that is welcoming to young people. Next slide. So creating spaces that are welcoming to youth. So this is this isn't actually an SBHC, but it is a wellness center inside of Chemawa that's run by the SBHC. They have a therapist that sits in here to then connect the students to the SBHC. Next slide. More spaces that are welcoming to youth. Next slide. the chairs in Baker, right? Making little spaces that are super comfortable. And next slide. Exam table at one of the elementary schools in Medford. And continuing on with, you know, great photos of spaces. Next slide. This is a mental health therapist's room. And, you know, years ago when we had a youth panel at one of our coordinators meeting, they talked all about twinkle lights, how they love to see twinkle lights. So, you know, here's a good example of that. And then artwork. A lot of SBHCs have student artwork that they, you know, profile on the in their spaces. Next slide. So intake forms, posters, and materials that are inclusive and reflect diversity. You know, is your SBHC ensuring that you have culturally and linguistically appropriate services? So again, intake forms, posters, and materials. Oops, I did that wrong on my slide. That include language is LGBTQ to AI plus, right? Okay, next slide. Create spaces to welcome youth of all identities. And these are pictures from, you know, y'all's SBHC, so hopefully you're seeing some of yourselves up there. And provide auditory and visual privacy. I spent an hour looking for a picture of a noise machine in one of your SBHCs, which you all have. We didn't take any pictures. So here's an example of an SBHC that is open to the community, and the side of the SBHC closest to the school has its own lobby and entrance for the students of that school. Okay, next slide. Identify young people's needs and connect them to additional resources. So next slide. So that would be scheduling longer visits to make sure that youth have time to talk about all the things, right? So I know that some SBHCs schedule like 40-minute well childs, you know, because there's a lot that's going to be brought up during those times. Next slide. Connect young people to additional youth-friendly services in your community. All right, next slide. Provide confidential services. So develop and post a confidentiality policy that is aligned with state laws. I know that, I don't know what this document is currently being worked on. Is that right, Kate? Like, right. So I'm trying to make it more youth facing, I believe. Next slide. Again, develop and post confidentiality policy aligned with state laws. Next slide. Provide clear information about which services can be accessed confidentially. And I believe this is a consent form for students to sign before they give consent to treat, right? To talk about things that can be kept confidential and things that can't be kept confidential. Next slide. Develop clear information about rights and responsibilities. Next slide. And develop and implement procedures that preserve confidentiality, right? So quite a few SBHCs have, you can go to the next slide too, Kwong. Quite a few, thank you, you know, have these things in the front of the SBHC so that when students come in, they don't have to say out loud in front of other people what they're there for. You can just kind of go into the box. All right, next slide. Implement a youth-friendly marketing and communication plan. So engage youth in the development of a marketing plan. So when Multnomah County rebranded, They had youth help them create that brand and name and design. Next slide. So Neocani is a new school-based health center, and they engaged youth in the development of their marketing plan by soliciting youth involvement to help design their logo, name, floor plan. And I think there was more, but yeah, so youth were highly involved in designing that. Next slide. Increase your awareness of your services and how to access them. So, you know, making sure that people know where you are and when you're open and what the services are. Next slide. Maintain an up-to-date presence on social media. So I think this is a Instagram account that one of the Sbhcs has. Next slide. Maintain an up-to-date website. And advertise services in ways that engage youth. Next slide. Solicit feedback on your services. So let's see. Engage young people to provide feedback on your services, right? So that's our survey. So advertising in a way that, you know, doesn't make it look so dry. Next slide. And consider youth action or advisory council for your Sbhc, which leads us into the next section. So youth advisory and action councils. Slide. All right, so our office has several toolkits pictured here on the slide that can provide direction for you to build and grow a YAC at your Sbhc, including connecting with other YACs. And then we also extend any relevant youth-led project trainings and technical assistance opportunities to the Svhcs. Next slide. As part of the mental health expansion grant, we allocate, well, the state allocates $700,000 to support youth-led projects. Listed here are the project proposals from this biennium's grantees. So it's not youth action advisory councils are part of it, but there's also other youth-led activities that are sponsored by these grants. Next slide. So we're just going to profile some of the things that these youth-led projects have done. And these were posters designed by a YAC member at Milwaukee High School and can be seen throughout the Sbhc. Next slide. So in this situation, YAC members surveyed 400 students about stress, wellness, and access to resources, and results have allowed them to present to school staff and on how to support students better and advocate for changes, such as better highlight SBH services on their school grounds. Next slide. 2 YACs started podcasts during the pandemic to talk about issues relevant to their communities. Next slide. And then YAC members worked on wellness campaigns regarding this Instagram campaign. This was Tualatin High School. These are all such amazing things that are happening, right? Deschutes County piloted having YACs as a class instead of a club. And students in the class were instrumental in advancing the Menstrual Dignity Act. That was a big lift. So that is not, you know, having the class was a big lift for that school. Okay, next slide. Students also redesigned mosaic medical signs and flyers for the Sbhc and created a video project that helped increase awareness, which showed an increase in usage of health center immediately following the launch. So another example of kind of rebranding with youth involvement. Next slide. So let's see, this is in Sister. So Sources of Strength peer leader group was trained in March, then launched their first campaign to get word out about sources of strength. And then they created this 8-foot tall wheel that students could place sticky notes on and identify their sources throughout the week. Next slide. And then among many community-oriented projects, Churchill Yak held Mental Health Awareness Month, events during lunch break on campus, including spaces to have creative outlets. Next slide. And then 2 of Multnomah County's Yak seen here, a mental health focused retreat and guest speakers and Valentine Carnation fundraiser for houseless youth in Portland. So hopefully you all can see there all the great work, that all the great things that are happening across the state in Oregon, and the spaces created for youth and youth getting involved in all of that. And it's just super exciting to see and to be a part of. And we appreciate all of that work that you all are doing. So I think,
I was just going to say, Rebecca, that with the last 2 years of COVID and school being completely virtual, remote, right? We are having to jumpstart this whole thing over again. So if you have any ideas on how to jumpstart this, these were great ideas to start thinking about it.
Yeah.
To
Great.
recruit a new Yak, right? I mean, the people not even longer at the schools anymore. So
yeah, I mean, that's a good point. They're great ideas. It's great work. It's amazing. And it takes a lot of support and starting over, right? Because I think things are super tough right now coming back, and we're hearing from a lot of
we'll get there. It's just it's gonna have to be baby steps and getting back to where we were 2 years ago.
Well, we're definitely thinking about it, and I know that Kate can speak more to funding potentials and working with the state and trying to figure out how we can better support you all and the youth that you serve. So we're continually trying to work on those things.
In the past, we did it over lunch. So we got them pizza and had lunch with them. So they're not be away from class time, because 90% of them is bus people from the high school. So we could meet earlier or later in the day. So the lunch time, and meet at least once a month. We would have to be providing their lunch, and the Little Caesar pizza was the ticket a couple of years ago. So if there's any funding coming, support that a little bit, that would be very, very helpful.
Right.
Thanks.
I think, Kate, I was just gonna say, I think at this point it's like 5 to 10, right? I don't want to go longer for anybody. And we have resources. We were going to talk about our resources, but we'll send out the webinar, right? And you all can see our resources. Does that sound good, Kate?
Yeah, I think maybe we can there's actually one that I would want to highlight in particular in response to your question, Svhc. So maybe if you want to go through Kwong, the next couple slides are really like external resources for you all to look at. There's reference to some great things from the Department of Ed. If you want to go next slide, Kwong, for you all to check out. Next slide, there's a great resource on HIPAA FERPA, which is something that's really important for folks to understand the difference when you're working with schools. The clinical medical work you all do is under HIPAA, but the school side is all under FERPA, which is very different. So check that out. Next slide.
This particular slide there, Katie, the HIPAA FERPA, is that through CDC or ODE?
This is through CDC.
CDC.
Huh. So check that out. And then the next ones we've referenced, Adolescent Health Initiative, the School-Based Health Alliance have great resources. We also wanted to give a shout out on the, if you go down to Kwong, so next slide, and then the one after that. So it's School-Based Health Alliance, and then yeah, the Oregon School-Based Health Alliance does a lot of legislative advocacy work to support school-based health centers and youth engagement work. So definitely check out their website. They're a really important partner. And then just keep going down. I think maybe next couple slides. So there's a lot of resources from our website for site coordinators and administrators. Definitely check out our website. I think there's two particular things I want to flag. This is a map of your nurses. All of it's on our website. There's our email for you to get in touch with. I would just want to flag, so we just started a newsletter. If you are new and not on our coordinators list, you may not already be signed up for these. Please subscribe. We'll send out a lot of these resources and flag information every 2 weeks for folks to get.
Yeah,
next slide.
that's great, Katie. That's really great.
Yeah, hopefully it's helpful. We're gonna we're filling it out, and then we'll do an evaluation to see if it's helpful.
Yeah, I think that's good. Keeping up more consistency, right? On what's going on. When will these slides be available again?
Probably the next week or two.
Okay.
If you want to skip down, Kwong, and there's just different things that we provide. Our website's a great resource. There's checklists to help you prepare for certification. Our annual status reports or updates. We do fact sheets for each individual school-based health center, summarizing the data that you submit to us. Next slide, we have brochures. Then importantly, we have coordinators meetings. The next one is scheduled for October 27th. We ask that at least one person from each center come. So Kwong just sent out the registration for that. Please sign up. Here are the additional dates for the rest of the school year, so mark your calendars. So
Katie, will this be, this will be virtual again, right? This is not
Unfortunately, so Sbhc knows, like, we have traditionally done our fall one in person, which is a really wonderful opportunity for people to actually meet each other and connect. We're not going to do that this year, but I think next year we will do that. Yeah,
very, very good.
And then so the next slide is one I wanted to highlight. So you had asked Sbhc about how to kickstart youth engagement. We have a training series coming up on how to work with young people. Mark your calendars for that. We're going to send out information about it in our newsletter on Friday with the link to sign up for it. But it's a 3-part series on how to work with young people. And so then important dates for you to keep in mind. That's really just summarizing the information that we went over earlier in the presentation. And I think that's it. Sorry to rush through the resources. There's just so much content. It's hard to keep it in an hour and a half, but thanks for bearing with us. As we said, this will be up online. We'll send out the slides. Here's a link to our website and our email address for getting in touch with us. Rebecca, anything else you want to add before we close?
No, I don't think so. Thanks everybody for coming. And
yes, thank you. This is great. It's always good to get the refresher and hear new things.
Thanks so much. Bye, everybody.
Bye-bye.